Okay. Hi, everybody. I'm Olivia Avanzato. I'm actually the class of 2011 from SUNY Oneonta, and I work in the Office of Alumni Engagement. And I'm here supporting Tammy LaPalooza, the program coordinator for pre-health professions, with this panel of our recent alumni that are back to share their wisdom and their career journeys with all of us. So on behalf of the Office of Alumni Engagement and the Alumni Association, we're so grateful that you're sharing your time and energy with us. And with that, I will turn it over to Tammy.
Hi, everyone. Welcome. Good evening. I'm glad that you can join us tonight so that we can welcome back some of our recent pre-health professions alumni so that they can talk to you a little bit about where they're at in their career, how they got there, some of the activities they participated in while they were at SUNY Oneonta. And again, thank you, Olivia, for hosting us through the Alumni Association, and certainly on behalf of the School of Sciences and the Pre-Health Professions Program Office, welcome everyone. So I think tonight we'll go ahead and we'll get started, and we'll have each of our recent alumni introduce themselves, tell us who they are, what year they graduated Oneonta, and where they're at in their path. So whether they're still in their professional school, if they've graduated in residency, and then once everyone introduces themselves, we'll start with some questions for our panelists. I think Mary, I think I've got you listed to go first.
Yep. My name is Mary Okoh. I graduated SUNY Oneonta back in 2014. I was a bio major, chemistry minor, and I'm currently a fourth year medical student at American University of Antigua. And I'm currently doing my cardiology elective right here in Brooklyn.
Wonderful. Nice to meet you. Welcome back. So Nicholas, you can go ahead and introduce yourself.
Hi, everyone. My name is Nick Brennan. I graduated Oneonta back in 2016, and I'm in my fourth year of the MD PhD program at SUNY Upstate Medical University. And then in Oneonta, I was a chemistry major, and my concentration was biochemistry.
Great. Thanks, Nick. Kemi, you can go ahead and introduce yourself.
Hey everybody, I'm Kemi Olunmuko. I'm one of the class of 2013. And while I was in Oneonta, I was a human bio and psychology major. And right now I am actually a resident at Indiana State University, OBGYN residency program.
Great, thanks. Welcome this evening. Taryn, you can go ahead and introduce yourself.
Hi, I'm Taryn. I graduated in December of 2018. I'm a third-year student at University at Buffalo School of Dental Medicine, and my undergrad degree was biology with a chem minor.
Wonderful, great. Thanks for joining us. So I think one of the questions I think that I get pretty frequently from a lot of our current pre-health students, a lot of them are really trying to decide which is the career path that they want to pursue, whether it's MD, DO, whether they're in between. Do I want to work in human medicine, animal medicine? Certainly, Taryn, you've chosen the path of dentistry. And so I'm wondering if each of you could speak to, how you decided on the career path that you wanted to pursue. I know Mary and Kemi, you're both in a traditional medicine program. Nick, you're in an MD PhD program, which has its own special challenges. So I think I'm not sure who would like to go first. Maybe perhaps Kemi, because you're graduated, you're in your residency. And so how did you get from an undergrad first semester freshman to deciding that, now you're doing a residency in OBGYN?
Okay, sure. I'm actually a DO, so I decided to go to DO school, and I did a DO MBA, so I'm actually dual degreed. From Oneonta, do you want like a stepwise, like how I?
Yeah. I mean, kind of what was your process, right? Because you start undergrad, most students start undergrad with this idea that they want to work in healthcare. Mm-hmm. And so getting from that initial idea, I want to work in healthcare to, kind of now, your story is that you're OBGYN resident.
Okay.
I don't know the elevator version of it, right? The short version.
It's still surprising many times. So I started only, I think I came to Oneonta in 2010. I was one of the people that started in the January class. So I always knew I wanted to be a doctor. Coming in, I knew I wanted to be a bio major, but I was also very interested in psych. So that's how I was dual majored in that. And it was a really great perspective to just learn like human behavior and all of that. That was awesome. Subsequently, after graduating, I took the MCAT, did not do well. Many people don't. So do not think like if you don't do well with the MCAT, like that's the end all be all for you. It is not. So I took a little bit time off to study back in, I graduated December 2013, time off to study. And during that time, I got into something called Project Healthcare in New York City, where basically it's kind of like an internship, very intense program in Bellevue Hospital affiliated with NYU. It's still going on. Highly recommended for anybody that wants to, that's interested in like pre-health. Basically, they throw you into all the different specialties, ED, peds, psych, everything, and you get to work with the residents, you get to work with the patients. You just get you get exposure to medicine, and it was awesome. From there, I was able to get letters of recommendations. They were able to teach me really how to study. Ended up retaking the MCAT and then applying to post-bac. I got into a program in Tennessee. Subsequently after that, decided I actually wanted to do a master's. I got my master's of science. Then from there, immediately transitioned into medical school in 2017. It was a 4-year DO MBA program for me. So it was the same amount of 4 years of medical school, but with the added business component, which was tough. But I'm sure Nick will say the same with all your PhD stuff. It is a lot, but you're doing it and I'm sure you're killing it. Recently graduated last year, so I'm a fresh new resident here and I'm really, really excited.
What a great story. And certainly I think, adding the MBA to a medical school is definitely a unique combination, which possibly later in your career could actually serve you really well, depending on, kind of where your path takes you. I think that's a really nice compliment.
Absolutely. And I think it's also, with physicians these days or dentists, anybody, I think the new, I don't want to say fad, but the new thing is don't put all your eggs in one basket, and also have multiple streams of income. So even if you want to be a physician, always have that something behind so you can be able to fall back on.
Right, absolutely. So I think we'll maybe transition to Taryn next, only because I know that you actually jumped right from undergrad into dental school. So perhaps you can share a little bit with everyone how you knew without a doubt that dental school was for you and went from point A to point B relatively quickly in the process.
Yeah, so growing up, my best friend, her dad was a dentist and had like the most amazing work-life balance, along with I've always liked healthcare, but it made me realize like I didn't want to be a physician. Like I have family members that are physicians, like their residency was like 80 hours plus a week. And even after they graduated, I mean, it took a long time, even after residency, to like get to like a good work-life balance. And I knew that just like totally was not for me. So I started shadowing a lot when I was in high school and through undergrad. And that just like really showed that it was definitely dentistry I wanted to do. My junior year, I want to say between junior and senior year of college, I took my DAT, which is somewhat similar to the MCAT, but much less involved than the MCAT is. So I took that. I was happy with my scores, was able to apply. I actually got accepted into dental schools the same day that I graduated undergrad. So that was kind of exciting since I graduated in December. And then I just had a semester off since I graduated a semester early and we didn't start until August. So I worked full time, which allowed me to save up enough money to actually pay for my first semester of dental school, which was awesome. So yeah, now I'm in my third year and we're getting close to being done, but not close enough.
That might be a similar theme, close enough, but just not quite. So I think Kemi is the only one that is actually done, right? Mary, you're not quite done yet. No. No, do you want to tell us a little bit about your journey and where you're at, and how you got from your first year at Oneonta into now? Well, I guess now you're wrapping up your fourth year, so you're a little bit closer than Taryn is to being finished.
Yeah, I started. When did I start? Oneonta back in. I actually went to a different school, then I transferred into Oneonta during my sophomore year back in 2011. And I came into undergrad knowing I wanted to go into healthcare already from like middle school. So I kind of really goal oriented, and when I have a goal, I kind of go for it. So I came in with bio major. I knew I was going to do that. Chemistry minor kind of stumbled on that. I was just like, well, let's take an extra chemistry class, get the minor. And then when I was in Oneonta, I kind of got solidified when I joined OSIS, the Oneonta State Emergency Squad there. That's how I knew I wanted to kind of like look more into maybe emergency medicine. That's how I kind of figured out what specialty I wanted to go into. And then after I graduated Oneonta in 2014, I did the MCAT. Me and them were not good friends either as well. So I took some time off. I worked as an EMT. I worked as basically like a camp nurse as well over the summer at different camps as well, being a health director there. And eventually, I think it was like some of my parents, like family friends who also went to like more of the Caribbean medical school route, told me about it. So I looked more into it, and they were residents back then, they're attendings now. And yeah, so I looked into it, saw American University of Antigua, which one of my family friends went to. And I was really happy with my choice. I kind of just want to jump into it because at the time I was coming in the spring semester. I know a lot of people start in the fall. So when I finally started med school in 2018, yeah, everything's been going great since then. I'm a fourth year now, and yeah, going to be applying for residency soon. So very excited for all of that and doing my sub internships and everything like that.
A very, very exciting time. And we do have students that do occasionally, they go to the Caribbean medical schools and they are very successful getting residencies. So it's a very exciting time for sure. And I think, Nick, you've got a little ways to go because you're doing the MD, PhD combo. So I'm wondering if you can share with everyone, how you not only knew that you wanted to be a physician, but then made that transition to decide that not only are you going to get an MD, you're also going to add the PhD on top of that. And I think kind of what for you, adding that PhD provides for you intellectually and career-wise.
Sure. So I started Oneonta. So I transferred to Oneonta also my second year, my sophomore year. So that was back in 2013. I always knew I wanted to do medicine. And then, so shortly after graduating, there was a program down at the NIH that was meant for people interested in medical school that didn't have much research. So I planned to be there for only 1 year doing full-time research after graduation. And then I really liked it, so I stayed there for 2 years. And all my supervisors were MD PhDs, and they kind of like just enlightened me on what the career path could look like and just the integration of medicine and research. And I love the idea of academic medicine. I want to work at an academic medical center. So right before I applied, I essentially decided I wanted to add on the PhD. And now I'm about halfway through and I really like it. So, but it was very last minute, I guess. I'm adding on the PhD compared to when I knew I wanted to do medicine.
Right, yeah, it's a little bit more involved. It's the PhD part is an additional 3 years on top of the 4-year medical program, correct?
So it's actually 4 years. Some people do it in 3, but I'm in the biochem department, which is very difficult to do it. So I got a solid 8 years, but I'm about halfway through now.
That's great. But I think, finding a career and a passion that you really enjoy, and I think certainly being able to combine your passion for research and medicine, I think it'll be a really great combination when you finish and start your medical career. Right. So, yeah, so I think it sounds like everyone has been really successful, certainly on your path. During your time at Oneonta, so whether, you had came in as a transfer student or in a traditional four-year program, what were some of the other things that you did while you were at Oneonta? Because I think, obviously everyone needs to do well academically in your classes. Some of you did pick up minors, but a lot of students do ask, what are those other pieces that you do to really supplement your academic background and preparation for medical school? So I'm wondering if each of you could speak to that. I say maybe we'll work our way backwards. So maybe we'll start with Nick and we'll work our way back. Because you did mention a little bit of research. Did you do some research while you were at Oneonta also?
Yeah, so from the very beginning, I always made sure, kind of like you said, to prioritize school, but I did recognize the importance of extracurriculars also. So right after coming to SUNY Oneonta, I got involved with OSIS, right? And then I was on student government from the very beginning also, the SA Senate, I believe it's called. It's been a while. And then I also decided to TA for a few years also. I really enjoyed that. I volunteered for the admissions office as well as joined some other clubs. In terms of the research, I did a summer internship at Stony Brook doing chemistry research. But when I was at Oneonta, I did one of the, it was essentially an elective, like a research elective with Dr. Odago in the chemistry department. And that's kind of what sparked my interest in research.
Great. Yeah, wonderful to hear that you were actually one of my first pre-health students, because you were a TA when I was teaching cell and molecular biology labs. So kind of my first cohort of students to kind of send off to medical school. Great. And so I think, Mary, you were also a transfer student. I think one of the things too is, for transfer students getting settled into kind of a new school space and getting involved in activities. What else did you get involved in while you were at Oneonta, besides, academics and adding your chemistry minor?
Yeah, so I was like the same way, like it's kind of like school first, but and transferring is always definitely hard because everyone kind of makes their friends during their freshman year. So it's kind of hard to kind of slip in during your sophomore year. But joining OSIS probably made like a lot of my friends back in those days. And then also, I was also a TA for Gen Bio for a little bit as well. And then usually like over the summers, I would volunteer at my town's also emergency squad as well. So those were the kind of things I was just juggling back and forth. So those basically took a bulk of my time when I wasn't also doing like work study and like putting the theater set together and things like that.
Right, so you're also involved in theater on campus?
Just like when I did like work study, I worked on the theater department as well. So it was, I always say I probably learned a lot life skills from that, just from learning these power tools and things like that carried on till today. So that was something I didn't think I was going to take from back then. That's actually helped me. One of the higher things that helped me a lot today.
Yeah, and I know it's kind of the cheesy part of it. A lot of students talk about watching Grey's Anatomy, but there are power tools involved in surgery. So having some experience using, mechanical equipment could actually come in quite handy, depending on what you need to do in a medical environment. Obviously, not quite the same, but a nice way to complement what you've done. And I think, and I know that a lot of students are still very interested in getting involved in OSIS. And for a lot of them, that is their introduction to emergency medicine. I think, Kemi, you were also on OSIS as well, correct?
Yes, I was. I was part of OSIS as well. And that was my introduction as well. I didn't take more like the science route like everybody when it came to like extracurriculars. I was not involved in research. I just knew very early on research was not for me. But my mental health was very, very important to me while I was in undergrad. So I knew I also needed to do some leadership activities. I was involved in student government when it came to the Caribbean Student Association. I was like treasurer, secretary, and at some point I was president. I was also, I think I was part of the Alpha Phi Omega. I'm not sure if it's still there. I think it's like the fraternity, the volunteer fraternity. That's yeah, so I was part of that. So my way of trying to like build up my resume was just lots of volunteering and just doing stuff with the community rather than doing like a lot of science stuff. I also did work study. I think I worked in the gym at some point. Just keep yourself very busy. Academics was always number one for me though. So during my summertime, I would go back home to New York, downstate, and I would enroll in community, I would take summer classes to be able to add more credits to my major so I could finish on time, because having 2 degrees, being dual majored, it kind of like lengthens your time that you have to like stay in not in medical school, in undergrad. So I just knew I had to supplement my summers.
Right, great. So you've not only double majored at undergrad, you also did it in medical school as well. So I think you're destined to double major in everything. So perhaps maybe picking up a second specialty after you finish your OBGYN residency.
No, I am done. I am done after this.
Great. And yeah, and so I know, Taryn, so I know that, you know, obviously you will get to work with power tools as a dentist.
That is all we do. All we have are drills.
Right. But I know that also you were involved in research as an undergrad as well, you know, and I think certainly, you know, having a really focused goal when you started Oneonta. I'm wondering, you know, tell us a little bit more about what you did during undergrad, you know, through both your service that you've worked on. I know that you worked on research, and so kind of fill in those other pieces for us.
Yeah, so I was not at all interested in clubs. That was totally not my thing. I took part in exactly 0 clubs, but I was really into psych. My boyfriend is now my fiance. He's graduated. He was in the psych department as well. He was a psych major. So I did research with him and with Dr. Zions, and we did stuff with like the opioid task force for Otsego County, which was really important because heroin addiction, I mean, across the country, but especially in rural America, is rampant. So we were able to do research with that, which funny enough kind of does have a lot to do with dentistry. I mean, and now we literally do not prescribe any like opioids whatsoever because we were a big part of the opioid epidemic. But so that was kind of interesting. And then I mostly just worked a lot. I was lucky in that I'm from Oneonta, so I knew a lot of people already in the college. So it was very easy for me to find jobs. So I worked as like an admissions assistant. I worked as a tour guide. I also like worked out in Delhi for not quite a pharmaceutical company, but sort of. So I did a lot of different jobs. I worked as a tutor for 3 years, I believe. I did like bio classes and chem classes, tutoring. And then I did a lot with the Head Start program in Oneonta, which if you don't know what Head Start is, it's like a preschool for like lower income families. They're able to go there for free. And so I was able to help with their dental program and help get more dentists in our community and in the greater community to be able to help and provide free dental care to these kids, which if you're not from Oneonta, I'm sure many of you aren't, there's no pediatric dentist for a 1-hour radius. So we had to call over an hour away and see if they would be able to provide free care. And then we also had to reach out to provide free transportation to these people. And I think it was just very eye-opening. I know a lot of people tend to do big service trips where they go out of the country, and that's great. But I think a lot of times we forget that there's a lot going on in our own community right next door. So that's like really important to me. So that's been able to transfer over because at University at Buffalo, we have a huge community outreach program here. And we provide a lot of free dental care and free education to the greater Buffalo community. So it's been a good fit for me.
That's great. Yeah, it's good to hear. I regularly have students ask, you know, about service trips. Can we leave the country, you know, because they think that in order to see underserved communities and healthcare, that they actually have to leave the United States to do that. And I regularly remind them that no, actually in Oneonta, we have quite a few communities where, you know, that is still the case. And so whether it's Oneonta, places that are more urban, you know, certainly rural areas have their own challenge with access to healthcare. And, you know, pediatric dentists being an hour away is certainly really inhibits getting regular dental care for young children. And I, yeah, and so service is a huge part of that. And so, we learned a little bit about what Taryn is doing for service that, ultimately started as an undergrad. I'm wondering if, our other panelists can speak to some of the service that, maybe that you might not have done as an undergrad, but some of the projects that you've been exposed to and are perhaps working on, in your current status, either as a student, resident, and because I know that each one of the medical schools has a little bit different areas that they work on and focus on for service and outreach. And maybe Kemi, would you like to go first? I think we'll start with Kemi.
Sure. I'll start with right now. I don't have, I'm sorry, not much time working 80, 100 hours to do lots of service activities now. I'm mostly just working. However, when I was in medical school, I did a lot because I just knew I've always known I wanted to be an OBGYN. And I knew women's health was very, very important to me. So I did a lot of things that were catered towards women's health. One thing was the domestic shelter. I volunteered there, went as a medical student, went there to basically educate people about like their health and their like medical health and medical well-being. Also, even as having my psych background, I think people just want to be heard. People just want you to talk to them, or want to talk to you, I should say. So that was a big part of my medical school, just going there on a monthly basis. I know lots of people do like soup kitchens, like do other things. I also was involved with helping with math for the local. When I was in Tennessee, I was also in a very rural place. I think I went from rural in Oneonta to other places like that. So I was helping with the middle school to teach them math during like after hours while I was in grad school. Also did the same for pre-health while I was working. After graduating from Oneonta, I think I was a K-5 teacher teaching them pre-health. So that was an interesting time in my life.
That's very exciting. Yeah, I think it's, different ways to serve the community. And I think for someone that is, interested in a career in women's health, in OBGYN, being able to do some outreach in some of the women's shelters, simply just to connect sometimes, I think provides just a different level of support for women that are going through challenging circumstances.
Absolutely.
So for sure. Mary, I wonder if you can speak to some of the service. I know that, OSIS is certainly, it's a volunteer rescue squad, and you mentioned that you did some service at home as well. I'm curious, with your opportunities in Antigua, were you doing any service there, and has some of that continued now that you're back in the city and back in the States?
Well, right now, no, currently.
Probably not right now, though. I know.
But when I was in Antigua, yes, it's actually right into our curriculum. We actually have these programs where we actually go out to the community, and we were doing just like health screenings, we're doing eye exams and things like that. Because you'd be surprised how many people, the kids there, don't even know they need glasses or something as simple as that, or they don't have any way of reaching the eye doctor. So we're kind of like the liaison to like tell them, you have eye problems, let's try to get you connected to an eye doctor. Or are you having like high blood pressure, let's try to get connected to a primary care physician as well. So that was something that I want to keep on doing, hopefully during residency if I have the time, but definitely after residency as well. I really like that. And then also just volunteering in my own community through what was Beacon Volunteer Ambulance in my area, and just trying to like reach out to community and give them emergency care when they needed it. So yeah, those two are things I want to continue doing. And if I end up going into emergency, I wouldn't mind doing a subspecialty in emergencies medical services, and still kind of have that background there, because something about emergency, like working as EMT, is still very important to me. So I will be able to like carry that through even as a MD one day as well.
Sure, yeah, absolutely. And I think, probably, with your, with working as an EMT, and certainly I think that pairs really well with a specialty in cardiology, you know, a lot of cardiac events happen on an emergency basis. And so whether you're seeing that as an emergency care provider or through a regular clinic diagnosing disease early, I think that those are really nice complement to each other. And I think, Nick, you probably might not have much time to volunteer right now as well either, but I'm sure that there are some periods where, you know, there are definitely some service opportunities for you. I think you were on OSIS also, right?
Yep. So in Oneonta, a lot of my volunteer was through OSIS, but so how my program works is you do the first 2 years of medical school, and then you take a break for the PhD for 4 years, and then you go back and finish the final 2 years of med school. But so recently I haven't had much time during my PhD years, but the first 2 years of medical school. So for example, I had some of my friends who volunteered for a free clinic that assist with the refugee community that's present in Syracuse. Because I think Syracuse is kind of unique where you have the urban setting, but then shortly outside you have a rural population. And so I'm part of the Rural Medical Scholars Program where this will be now my 7th and 8th year of school, but I'll be able to go into rural communities across New York State and rotate there and help out some of those communities. But during my first 2 years of med school, I did something called Peds Pals, where essentially you and another medical student are paired with a pediatric cancer patient who might not have a support system at home. So you're there to do mostly fun things with them, just be a role model for them. So that was one community outreach program. And then I did a diabetes elective where each med student is paired with a patient with diabetes that's poorly controlled. So just seeing the disease through their eyes and just emotionally supporting them and kind of serving as a liaison between them and some of the medical staff. So those were a couple of things I did during my first 2 years.
Great. Yeah, you know, Syracuse does have a really interesting community, and I know that it is one of the locations where a lot of refugees are resettling to. And so being able to have some outreach, again, to really, you know, some of these underserved communities that need some specialized medical care, I think that's really important that, you know, that upstate through their medical school community is able to help serve those individuals and those families. So that's really, really great to hear. Yeah, so I think everyone is, you know, very busy, has done quite a lot, and has worked incredibly hard to get where you're at today. So I'm wondering, you know, is there some advice, you know, that you'd like to share with some of our, you know, our emerging medical, healthcare, dental students that are listening in? You know, what kind of advice can you give them in preparing for this process? Because it is a very lengthy process. Things have certainly not, things have been a little bit harder the last couple of years. And so, you know, maybe, you know, what advice, you know, what's been challenging and what advice can you give our students? Because they also regularly ask me, you know, during the pandemic, all of this has just been really hard. So how, you know, kind of inspiration to help keep them pushing through. Oh, I don't know who to start.
Yeah,
I don't know who wants to start. Maybe Mary, you can go ahead and start.
No, so for advice, and then I'll go into like the challenging part, but like advice, the first thing I would always tell anyone is that you are not your scores. I think all of us can agree to that. That's like the number one thing. A lot of people kind of get discouraged when they hear that from other people, like, oh, you don't have this good MCAT score, so medicine's done for you. I'm like, there's always other avenues. There's other ways to go into medicine. And also, like, the one question you're going to get asked a lot on interviews is why medicine? And if you don't have that aha moment, don't freak out. Like, some people, it's like a bunch of steps that might get to it. So a lot of people always kind of freak out. It's like, I have to have this crazy answer and it has to be this moment, and this tragedy happened, and not everyone has the same story. So it's okay if it's like multiple moments that led up to it. And try to avoid the cliches in your interview. I know I'm kind of like going to start preparing for interviews, so it's kind of like bringing back memories of me applying to med school. So all this is coming back to me. And make sure the number one thing a lot of like program directors always advise when you're applying for residency is make sure you ask them questions. So that's something you want to keep in the back of your head to research the programs and med schools that you're going into, and make sure you ask them questions because you're trying to impress them, but they're also trying to impress you. That's a lot of people don't think about. So it's make sure to ask questions about their school and make sure that they fit you as well. And then challenging, especially because of COVID. I know right before my third year, a lot of rotations stopped. So that delayed me 5 months. And so that's why I'm applying next year instead of this year. But it's trying to get that good like balance of studying and specifically me and my clinical rotations and just knowing when to take a step back and have a mental health moment, a mental health day that helps, and try to like set a schedule for yourself and keep, because we all can probably agree, like it gets very hectic with like medical school or dental school. Like you really have to like learn how to take a step back when you start to get overwhelming, because it's medical school, dental school, it's going to be overwhelming. If it was easy, everyone would do it, and it's not for everyone. So yeah, I would say try to like protect your mental health and make sure you do research on these medical school programs as well.
Yeah, absolutely. And I think, Kemi, you already spoke to, prioritizing your mental health through all of this. And so, I think probably, the general theme is certainly protect your own mental health. But, what are some ways that you've navigated this and some advice that you can give our students as well as they're, thinking about getting from undergrad to someday residency or beyond?
For sure. Number one, your academics is very, very important. So definitely try to get good grades. And if you're struggling at any point, like get a tutor. There's no shame in getting a tutor. And have a group of people that you study with. So you can at least have people. I mean, you don't have to study with them like physically, but that keeps you accountable. So you're on top of your studies. If you're struggling with how to study, it might be important to basically learn the ways to study for an exam, because I think that's what I struggled with. That makes me more of a non-traditional student. So learn very early on how to study so you can do well on your exams. That's one. Number two, please, 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 clean up your social media. People do look on your social media to look you up. So make sure you're professional on there. I mean, don't just become you know what I mean, just be professional, but don't say too many outrageous things on there, because people in this day and age, everything is very accessible and they can look you up and they can judge you before they know you. And it's quite unfair, but it's just the way the world works right now. Number three, yes, protect your mental health, because that is what is going to carry you through right now. I'm pretty sure a lot of my colleagues will let you know there's just our career path is one of the leading career paths with the highest rates of suicide in the country. So if you're not taking care of yourself, it is going to be very hard to take care of other people. So if you don't, you need to be able to make sure you're doing good before you can be able to fill other people's cup up. So whatever you do that makes you happy, if it's just going out with your friends on Friday night or just Netflixing and chilling, like whatever it is that you do, going to the gym, make sure it's built into your regular routine, because that is always what you'll continue to look forward to after your very long and hectic week with studying and just life. This is a very long career path. So I think your mental health is number one, actually very, very important.
Yeah, no, that's great to hear. I've actually, it's been hard. I'm not working as a medical provider, but I am, helping advise and guide students who want to choose that as their path. And so I've started carving out time, even for myself, going to the gym, have something where, that is my space. I can tune out and it's not in front of another screen even, right? Because this has been difficult for everyone in very, very different ways. And so modeling some of the ways that I'm taking care of my own mental health to encourage our students to do that. I know that there's a big movement in higher education and even in younger years to really reinforce and provide support for mental health. I know that our campus has expanded their offerings as well. And I think it's a movement that I think is really long overdue. So it's nice to hear that, it's the overriding theme and certainly priority and prioritizing, because the habits need to start now if they haven't, because for people who are going to be working in healthcare, there's a long way to go. So for sure, yeah. So, Nick, you want to share a little bit about some of your advice for our students that are navigating this? And I think maybe perhaps, probably the same mental health and a few other pieces.
Yeah, so I guess in terms of the application process, so I spent a couple years interviewing applicants for my school, and I sit on the admissions committee now, and I think one of the most important pieces of advice for the application process is do not apply late. So many people, we review our stellar applicants, we would love to, have them, but if they apply late, there's just not spots. So I think my biggest piece of advice would be apply early, and then also, I think in terms of interviewing, it's very easy to have a scripted response for a lot of the questions. And I think it's very easy for interviewers to detect that. So I think just like being yourself and just showing the interviewers that you get along with people at the school, your mission fits the school's mission. I think that's important. And then another piece of advice, which I think would apply to both being in medical school and in undergrad, as well as studying for the MCAT, is do not compare yourself to other people. I remember when I first started med school, I was so obsessed with how everyone else was studying and should I study the same? And that just wasted so much of my time. So I think just spending time to figure out how you study best and how you'll perform best is important. And just, and if you have to take a gap year, again, just don't compare yourself to other people. Everyone's route to medical school or dental school, is different. So.
But yeah, great. Thanks, Nick. And Taryn, do you have some advice for our students that, slightly different kind of navigating all of this?
Yeah, I think the biggest thing is to know your why, like why it is you want to go into that field, because that's also what your personal statement is going to be about. That's what they're going to ask questions about in your interviews. And it needs to be like an authentic thing. For me, growing up in Oneonta in a rural community, like rural healthcare is extremely important to me. That's easy for me to talk for the next 5 hours about. So I feel like I was able to do pretty well in interviews just because it is something that I'm passionate about. So if you have something in that field that you're passionate about, maybe that's your why, and that's what you're going to end up writing about. And in terms of like mental health, I know a lot of people have been talking about that today. Our school actually implemented, because of COVID, we get 2 mental health days a semester. So you get to choose them. Granted, if you have a test, a quiz, or a patient, you can't use it. So it's a little difficult, but you can use it. So this afternoon, my patient canceled. I took a mental health day because I have 3 midterms tomorrow. I mean, you're able to like get a little bit of time off, which is really, really helpful. I wish they were able to implement it sooner, but definitely more and more schools are, I feel like, going that way. We actually have like our own mental health counselor that does like meditation sessions within the dental school. And we have like a wellness club that helps a lot with that too. So check out the schools and see like what they have to offer. I think that can be helpful in terms of you figuring out what's most important. And you definitely want to look into the financials of everything. Schools are getting more and more expensive. That's why I chose a SUNY school. Like I got accepted to NYU and I think it was going to be $100,000 a year. That's a lot of money that I do not have. So I chose a SUNY school. It's still a phenomenal school. And at the end of the day, we're all graduating with the same degree. So I think knowing your why, looking at the financials, those are all really big, important things.
Yeah, definitely. Some of those practical pieces, and many times when I'm working with students, one of the first things that I ask them is, well, why do you want to be a physician? Why do you want to be a dentist, right? What are those pieces? And I think that it does take students quite a while to really, they might know that that's what they want to do, but to be able to articulate that and share that passion that, no, really, this is why I know that I want to be a physician. This is why I want to be a cardiologist or an OBGYN or, a research, a medical scientist, right? Or a dentist, having that background so that it's very, very clear why that's where you should be and that's your path. And I think certainly, looking at the financials is becoming certainly more important. I encourage a lot of our students. We have some personal finance classes here. They're now minis. It's a one credit mini. You meet, 1 day a week for the entire semester. Sometimes you meet a little bit longer for maybe 5 weeks. Really looking at some of that financial planning just to have a better understanding of all of that. And definitely the standardized tests at this point, they're not going away. And so being able to navigate how to get through the MCAT, how to get through the GAT, and knowing that, the first time you take it, you might not get the score you want, but it doesn't mean that your chances of going into medical and dental school are completely gone. There are ways to navigate all of that, because ultimately, I think, and certainly with the pre-health students that I've worked at over the years, if they want it bad enough, they get there. And I think that that's definitely, I think it's definitely true here. And so I guess, we can maybe wrap up with kind of one last question that's kind of the hope, right? As we're hopefully coming out of it, or transitioning to kind of a new phase of what's happening with COVID. You're all embarking on your medical careers in residency, wrapping up years of school. Where do you see hope in moving forward from all of this within your respective specialties? I think maybe Taryn, we can start with you.
Yeah, so it's been very difficult the last couple of years. We had to change up a lot of how we were doing things. But it's also allowed for a lot of research opportunities, even within the dental field. I feel like a lot of people kind of forget about that, but we're probably the highest aerosol profession out of anything. And so because of that, it's caused like a lot of new research and like oral microbiome and like viral particles and whatnot, and how to like reduce that in our patients. And that has a lot to do with like kind of just pushing our profession forward in regards to like periodontal disease and different things. So it's been kind of interesting. I think in a way, a lot of good has come out of it. I feel like in the dental field, just with like the new research opportunities and new avenues, everybody's kind of able to start going down. But it's definitely been difficult. Not a huge fan of the N95 bruises, but it's got to do it.
Right. Thanks, Nick. I wonder if you can share a little bit, because you're certainly looking at more of the medical researcher field. Where can you see hope moving forward from all of this?
Yeah, so I was gonna say clinically, I can't speak too much because at the start of the pandemic is when my PhD started. So I wasn't in the clinic at all during COVID, but I think the fact that how quickly research has progressed with COVID and its implications, I think, is inspiring. But also in general, I've seen how just through my peers going through the process, how quickly medical schools are able to adapt, given, in the state of a pandemic, to just alter the curriculum to make sure that students are still prepared to go to residency. I think just with the medical field and medical schools being so adaptive, I think gives us hope for the future. Because if something is ever like this happen again, or even something different, it's inspiring to see how quickly we can navigate it and continue to prepare future healthcare professionals.
Great, thanks. And I think, Mary, you were out of the country when a lot of this happened. And so now you're back here. And so, kind of where do you see, you had a little bit of a different experience. And so where do you see kind of this hope moving forward, certainly as an international, doing medical school abroad?
Yeah, I remember, I think I left the island. It was my final semester in March 2020 when it just hit, because I was like, I'm going to stay on the island, study for step one. And then they're like, we're going to shut down the island. So I was like, I'm gone. All right. So I went back to New York. I'm from New York. And yeah, everything kind of like Nick was saying before, like medical school really transitioned to more like an online curriculum for the most part during 2020. And then, with me, I was just about to start my clinical rotation. So everything kind of stopped for rotations. People in the middle of their third and fourth year rotations kind of got pulled out of it because they weren't sure what was happening. But eventually they were able to like trickle us back in. It was kind of scary at first because you're having like, I was even given some COVID patients as well. And you're kind of like nervous, like, what am I doing? You're given this N95 and all this PPE, and they're like, go talk to the patient. You're like, okay. So you're just trying to kind of figure all of it out. But like, we're slowly transitioning back out of it, which has been good. I've noticed with applying for residencies, like everything's mostly online. You can go in person now, but more people are doing the online route for interviewing for residency, just because one, it cuts down a lot on costs. You don't have to pay for like traveling there and like staying at a place and food and travel. So I've noticed that a lot, and I think it's something they're going to keep now, at least for this year, this upcoming cycle coming in fall. They're still going to keep it, this hybrid thing going on. So that's interesting to see if that's something they're going to keep. There's even exams they've canceled altogether because of this. But But yeah, I feel like it made people kind of learn how to take a step back and figure out everything they wanted to do. And I also, like, without research, I joined like this research team that's learning about the neuropsychiatric manifestations of COVID-19 and all the different like some psychoses that are coming up because of people who had COVID. So it's just, you starting to like see a lot more research on it, which has been very interesting. Be seeing it in person and actually reading about it and just kind of like seeing everything and how it's progressing.
Interesting, great. Yeah, thank you. I think probably, yeah, a big transition, right? If you're on an island and they're about to shut it down, yeah, do you stay not knowing how long you'll need to be there, or do you get out quick? So
yeah, and they're still doing online now. Although it's a hybrid, you can do online or you go back to the island. It's more people are going back to the island now for the first 2 years, and then we do our last 2 years in the States doing our rotations. So
sure, yeah, as things open up, yeah, absolutely. And I guess, Kemi, can you talk a little bit about, you know, some of the challenges and kind of your hope as we're moving out of this?
Sure. When COVID hit, it was right in the middle of my third year when I was a medical student. So we were pulled out of rotations, which was kind of tough. We were pulled out for about 5 months as well. It was actually really commendable how our medical school was able to transition to online, how we were able to just learn a lot from the online setting. But of course, that had its limitations. I mean, there's only so much surgery you can learn online. You actually have to get your hands in there and be in the OR. Going back in my fourth year, just dealing with seeing COVID up close, seeing the really sick patients in the ICU with COVID, it was really sad. And even now as a resident, just compassion fatigue is it's a thing, and it's really overwhelming the medical care society. Just talking to patients all the time, and they're just, with the way social media is, and a lot of people are just getting their medical advice from friends or from social media, and social media just has a lot of incorrect information. So I think the best way, we as people that care about the healthcare for patients, I think it's very important for us to encourage our society to listen to your physicians. They're not out there to get you. Many people have just been patients have become very mean because of whatever they find online. So just talk to people to encourage them to listen to your physicians. Your physicians are not out to get you. They care about you. They went into medicine to learn all of these things to help you. And also try to remember your empathy. I think that's my hope for the future right now. One thing I think I forgot to mention throughout this entire panel discussion today was understanding there are different avenues to going into medicine. Yes, your scores matter, but they do not define you, like we said. And if you don't do well the first time, definitely try again. Don't let anybody keep you down. If you know this is what you want to do, keep going at it. There is the allopathic route, there's the osteopathic route. Obviously, we have our dental student on here. There's vet school. Not to say like any of that is easier. They are actually equally as hard to get into. The DATs, I've heard, is actually pretty, if not harder than the MCAT. So if you don't get into an allopathic school, try an osteopathic school, or just apply to all of them based on whatever philosophy you actually care for. I wanted to go to a DO school because I cared for that philosophy, just taking care of the whole patient as a whole. Don't limit yourself and put yourself in a bubble. I think that's my one major advice for you guys moving forward.
Yeah, thank Kemi. I think that's really important, Kemi, because one of the things that I am regularly telling all of our pre-health students is that you are your own person as you're embarking on this path, and everyone is trying to get to the same place, but everyone is going to get there very differently based on what they're going to be able to bring to the program, because not everyone is bringing the same thing. But the way that we are able to have, hopefully, right, my hope for the future is that we have a generation of healthcare providers, coming forward that really prioritize their own mental health so that they can help their own patients and really have that compassion, that compassion and connection with patients moving forward. So yeah, the one, good thing to come out of COVID is really people focusing on mental health and that compassion piece, because without compassion, I think that it really limits what medical providers can do, because you've got to be able to connect with your patients. And so to be able to make that happen, however we make that happen, and getting there with whatever path it takes you to get there, if that's where you want to be, I help students get there. But what I tell them is, I just help guide you. You're doing the hard work to get from here to there. I might write a letter, sign a piece of paper, but you're doing all of that work and whatever that needs to be. So, well, great. So I want to be respectful of everyone's time. I know that Taryn has a few exams tomorrow to study for, and everyone else has long days of work ahead of them. Olivia, I'm wondering if there's any questions in the chat or if we have time for a quick Q&A before we wrap it up this evening.
So far, there's no questions in the chat, but if any of the people are on and would like to ask a question, now is the time. I think you all did a great job. There was so many aspects of what you talked about, and especially mental health. I'm a trained mental health counselor in my past life, so it was good to hear that as a part of the conversation in the medical field and just as a service professional in general. So thank you.
Yeah, I'm a member of the National Association of Pre-Health Advisors, and the national conference is this summer. And there are several sessions on supporting the mental health of our pre-health students. And then there's also a panel that's basically us focusing on our own mental health so that we can, modeling positive mental health behavior so that we can be better at guiding and mentoring our own students, right? It's the modeling the behavior that we hope students can actually then build into their regular routines.
Yeah, definitely.
Yeah, because I tell them, if I'm not taking care of myself, I can't help them. If our medical providers aren't taking care of themselves, they can't take care of their patients. And so it's all very interrelated.
Agreed. Well, thank you all so much for being a part of this. This is such a valuable resource for our students on the call tonight and for future students that will watch the recording. So thank you so much from the Office of Alumni Engagement and the Alumni Association at SUNY Oneonta.
Yeah, thank you all very much. I appreciate your time this evening, and I look forward to hearing great things about your future medical and dental careers.
Thank you for having me.